Joining us. We are learning more tonight about the Superior boy accused of opening fire on Douglas County deputies. 13-year-old Carson Peterson is charged with attempted first-degree intentional homicide after allegedly shooting at officers Tuesday in the town of Superior. Well, today, Northern News Now spoke with Carson's father, who shared these photos of the boy and says he recently received full custody of his son. The father says that Carson was mostly raised by another family member who, according to Carson's dad, suffers from mental health issues and various other problems. He says that upbringing scarred Carson and has led to mental health issues of his own. According to Carson's dad, getting his son the help he needs has been difficult in the Twin Ports, and says the system failed him time and time again. While he says what Carson did is inexcusable, he's disappointed in the decision to charge him as an adult because it will once again keep the boy from getting the help he needs. So tonight we are looking into how serious the child mental health care crisis is in the Twin Ports. Northern News Now's Ryan Hayes is hearing from parents and professionals who paint a very dim picture.
It's a good community. However, sometimes that's just not enough, you know? We need more.
Deanna Ellis worked in Superior schools for years, helping at-risk youth navigate social and academic challenges.
We try to help them with the skills that we already have, but most of the time those skills, like our children's mental health, is beyond our skills and our resources.
While the schools have counselors and some services, Ellis, a mom, says facilities in the area not accepting their insurance has created barriers in getting her children support.
We came up with more questions than we had answers, and our insurance did not cover the hefty bill that it was.
Chrissy Bernard is the executive director for NAMI Lake Superior South Shore, who provide mental health services in Ashland, Bayfield, and Douglas counties.
Northwestern Wisconsin is in a desperate situation. We have a lack of providers, both for youth and adults.
She says the current system is more reactive to crises than proactively seeking to prevent them.
We don't have enough prevention education. We don't have enough funding going to prevention. There's very, very little funding going to prevention.
She added providers not accepting insurances and long wait lists are big issues.
8+ months, depending on where you go. And the waiting list causes the perpetuation of mental health symptoms, and that can only escalate their need and their crisis.
In many cases, people's only option is to go to the ER to get the mental health support they need. Understanding the barriers to getting mental health interventions in Northwest Wisconsin. In Superior, Ryan Hayes, Northern News Now.
Head over to northernnewsnow.com for more information about how Medicaid reimbursement rates are further exacerbating access to mental health services in Wisconsin versus Minnesota.